Is behaving developmentally abnormal, undesirable, worrying? Those that differ from social cultural. Eccentric abnormal, behaving dangerously abnormal. It is danger to self and others. Like for instance, urinate in bedroom closet, woman with sex addict with different men, Philippines crucifixion, real nails and cross. Age, abnormal, unexpected, aged, developmentally, social, and cultural. Maladaptive, distressed, dysfunctional. 135 billion spent on mental illness in U.S. 1 in 4 adults suffer from mental illness. 57% of with severe mental health condition do not get treated. Anxiety disorder, major depressive disorder, most common. Who treats mental disorders? Clinical and counseling psychologist, mental health counselor, marriage and family counselor / therapist, psychiatrist, psychiatric nurse, social worker, substance abuse counselor. Treatments in the old days: cold water trapdoor, spin chair to unconscious. Ancient theories: ancient Egypt, evil spirits, exorcism, trepanation procedure. Ancient theories: evil spirit. Classical Greek and Romanians. Prevailing views: humans are capable of understanding themselves as opposed to supernatural causes. Imbalance of humors. Hippocrates, father of medicine, Hippocrates. Mental disorders are biological in nature. Etiology of mental disorders equals physical disease. Brain chemical, full bodily humans imbalances. Blood, pallagam, black bile, yellow bile. Yellow bile, blood air. Black bile, earth, pallagam, water. First to identify hallucination, delusions, melancholia, mania. Hysteria, the wandering uterus. Treatment equals babies, so get married and have kids. Second treatment, changing environment conditions, draining in cold water, or poke and blood leaks. Influences of classical period, Greek/Roman, paved the way for biological psychological theories of mental illness. Psychiatry as a specialty. The Middle Age to the Renaissance, reversion to supernatural explanations, exorcism, witchcraft, 15th through 17th centuries, executed, witchcraft executed. Then the Renaissance, witchcraft, it was believed that witchcraft was a mental illness, and the punishment was either executed or the water flow test. More than 100,000 accused, mostly poor women, people with psychological disorders. Renaissance was a refuted demonic possession. Paralysis, hereditary, mental ill persons often called lunatics and idiots. Emergence of early asylums. Early asylums, first establishment in the early 16th century, St. Mary's of Bethlehem Hospital, madhouses. 19th century, general paralysis, syphilis, and biological link with madness. Penicillin treated it successfully. Philippine Fendi, moral treatment. Benjamin Rush, father of a U.S. psychiatrist, patients treated with respect and dignity and employed during treatment. Dorothea Dix, loved for better treatment of patients, is asylum. 32 hospitals built. William Grazinger believed brain as a part of mental illness. Emil Kraepel defined syndromes based on clusters of symptoms. 2 diagnoses: dementia, praxis, schizophrenia, and manic depressive insanity. Forum to 20th century, deplorable hospital conditions were still common through 1980s. Deinstitutionalizational movement shifted to community-based residence, created problems for both patients and society as a whole. The Community Mental Health Movement Centers, 1963 by Congress. Sigmund Freud, known for dream analysis, epidemics content iceberg. Psychoanalysis. Behaviors are controlled by unconscious biological and sexual urges. What's embedded in conscious was programmed in your childhood. Infancy and parenting is critical. Dig to conscious, the structure of mind, the pleasure of principle, most greedy. Superego, the ideal self. Ego, the reality principle, defense mechanism. Anxiety from ID and superego conflict. Behaviorism. Ancient period, evil spirits and turbulization. Classical Greek, Roman imbalanced hormones, get married or pregnant. Witchcraft waterfall test. Research in abnormal psychology at the individuals. Parameters of measure, validity. The degree to which a test measures what it intends to measure. Construct validity. Convergent validity and discriminant validity. Divergent validity. Parameters of measuring personality. Predictive validity, a type of criterion validity. The measurement can blank relevant blank criteria. Developmental and cultural considerations. Factors to consider when choosing assessment techniques and instruments. Personality assessment must have B. Reliability and validity. Assessment instruments. Clinical intervals. Assessment instruments. Psychological personality test. Objective test. The test taker's response to a series of straightforward statements, and the responses are second scored according to a blank are based on empirical research. Personality inventories. Projective test. The person is presented with a series of ambiguous stimulants. Projective test. Assumptions. Assessment instruments. Assessment of cognitive functioning. Neuropsychological testing and intelligence testing. Neuropsychological testing detects impairment in cognitive functioning. Gestalt, Wisconsin card sort test. Assessment instruments. Assessment of cognitive functioning. Intelligence testing produce an intelligence quotient IQ score. Webster Adult Intelligence Scale. Weiss. Sanford Bingen Intelligence Scale. Behavioral assessment. Behavioral observation, self-monitoring. Psychological assessment measures brain structure, brain function, and nervous system, nervous activity. Electroencephalography, EEG. Magnetic resonance image, MRI. Galvanic skin response, GSR. Biofeedback. Interpretation, appraisal of cultural background. Benefits and potential problems of making diagnosis. History of classification abnormal behavior, diagnosis and statistical manual of mental disorders. This book contained 106 categories of mental disorders. International classification of diseases and related health problems. Developed of New York, currently 10th edition. Diagnosis classifying abnormal behavior. Dimensional approach, classification approach. What is used? Who treats mental disorders? Clinical and counseling psychologist, mental health counselor, marriage and family counselor / therapist, psychiatrist, psychiatric nurse, social worker, substance abuse counselor. Classic Greek and Roman periods. Prevailing views. Melampus of Pilus. Classic Greek and Roman periods. Hippocrates, father of medicine. First to identify hallucination, delusions, melancholia, and mania. melancholia, and mania. Hippocrates. Hippocrates. 4 bodily fluids, humors. The 4 are blood, phlegm, black bile, yellow bile. Depression meant too much black bile. Influences of the classical period. The Middle Age to the Renaissance. Roman Catholic Church, the work of the devil. The Middle Age to the Renaissance. Witchcraft, 15th through 17th centuries. More than 100,000 accused, mostly poor women. The water float test. The Middle Age to the Renaissance. Paracelsus, emergence of early asylum. The Middle Age to the Renaissance, early asylum. The 19th century, and the biological link with madness. Penicillin treated it successfully. The 19th century. In the U.S., Benjamin Rush, 19th century, believed brain as a root of mental illness. The 20th century. Deplorable hospital condition was still common through the 1950s. Shifted to community-based residence, created problems for both patients and society as a whole. Community mental health centers, 1963, by Congress. The 20th century. Psychoanalysis. Behaviors are controlled by unconscious biological and sexual urges. Infancy and parenting is critical. The structure of mind. ID, superego, ego. Defense mechanism, anxiety from ID, superego conflict. The 20th century behaviorism. Abnormal behaviors can be Ivan Pavlov, classical conditioning. John Watson's little Albert, phobia formation. Contemporary views. Biological models, contemporary psychoanalytical models, contemporary behavior models, cognitive models, social cultural models, biosocial models, biopsychosocial models. Contemporary views. Biological models assumes that abnormal behavior results from blank. Contemporary views. Biological models. The brain structure, biological scarring, explores the roles of genes and environments in transmission of behavioral traits. Modern psychoanalytic models no longer discuss the ID or fixation at the phallic stage. Contemporary views. Cognitive/behavioral models. Behavioral models acknowledge that biology interacts with the environment to influence behavior. B.F. Skinner, vicarious conditioning. Contemporary views. Cognitive/behavioral models. Cognitive models. Aaron Beck. Contemporary views. Humanistic models. Humanistic models based on phenomenology, striving for blank. Contemporary views. Social cultural models. Abnormal behavior must be understood within the context of social and cultural factors. The biopsychosocial model. The biopsychosocial model perspective acknowledges that each individual case is unique, so no single model can fully explain the abnormal behavior.